Now, Dr. Ra, you said over 80,000 patients at a single clinic. You have multiple clinics. So you have a very good sense, and you've seen patients from around the world. I have to ask you, how do American patients match up to European? Do you see a difference besides what they're bringing in their binders, you said, that are so much bigger? Aside from binders, are you seeing any difference in the biological aspects of the two? Is an American diet and lifestyle more toxic? I'm curious about that.
Yeah. Well, we have patients from all over the world. That's very interesting. And you're right. In the American population, I really see much higher toxicity and much higher congestive kind of the tissue stacking, so to say. Much more, just load in the tissue. So, but this is one, that's the metabolic side. And the other side, unfortunately, is also a very mechanistic approach to the body and to the health questions. But this comes from the last 20 or 30 years of education. If you have somebody, you go something, then you go to the specialist. The specialist makes the examinations, then you get the diagnosis, and then you get the medication. It's extremely passive. The approach of, and we even have the good selection. Who comes to Switzerland to my treatment? They are already a super positive selection from mindset, and they are, well, unfortunately, very often a negative selection from health situation. We get the sick ones, but the ones with a good mindset. So, but the average, when I go, I have the big chance to go to Hippocrates Clinic as an example, to do my consulting there regularly. I went there for cancer patients, and I see their approach is more mechanistic, more believing in the super specialists, even though they have no results.
What are the common illnesses that you are seeing nowadays? I know in the past, and it probably still is, you're seeing, of course, a lot of Lyme disease, as we are, something I'll get into, a little bit more later. But are there things you're seeing more of now in the last 10, 20 years that you didn't see before, as far as just people coming in with conditions?
Yeah, we have clearly more neurological diseases, more brain cognitive decline, explosive increase of autistic children. We have a lot of autistic children. Well, dear parents, if you have a child like this, please come to us. I never would say we heal the child, but it gets much better than what they experienced before.
Yes.
That's a big, big problem. And we have more viral diseases, bacterial diseases go back, very rarely malaria or tuberculosis or all these, or scarlet fever, and all these things went back, very rare nowadays, even in Europe. But we have these viral diseases which come up, and multi-infectious diseases, and the borreliosis, the Lyme. But Lyme, we can talk later more. Lyme is one expression which is showing how much environmental problems come into diseases, because Lyme you only get if you are very toxic. But this is another topic. So it changed very much.